Hello class, my name is Ileana Guzman and I worked with Oren Griffith on this project. We were assigned the Middle Ages and Renaissance period. So I'm going to start with a brief overview. As mentioned in our class textbook, the Middle Ages took place after the demise of the Roman Empire. This made Roman settlements vulnerable to attacks from barbaric invaders. So as a means of protection, communities gathered and grew within city walls. People lived in such close proximity from one another with their animals, and that caused diseases to easily spread. One of the most gruesome diseases of this time was leprosy. Leprosy was highly contagious and painful. Lepers were forced to wear bells and carry rods so that others could identify them. They were also forced to leave the city and remain in isolation. Eventually, leprosy hospitals were established and managed by monks. These hospitals provided housing and care for quarantined patients. Today, hospitals play a significant role in health education and promotion. They still provide a variety of care and services for the ill. In addition, self-isolation and quarantining still plays a role in minimizing the spread of communicable diseases. In addition to leprosy, the bubonic plague, also known as the Black Death, spread through Europe. This plague claimed the lives of over 1/3 of Europe's population at the time. The chief method of combating the plague was to isolate known or suspected cases, as well as persons who had been in contact with them. The period of isolation at first was 14 days and gradually was increased to 40 days. In an effort to prevent the plague from spreading, public officials invested in sanitary systems, pure water supplies, food inspection, and sewage disposal. These advancements contributed to the public health services we use today. We have sanitary sewage systems, waste management companies in communities throughout the U.S. We use waste management companies to dispose of our garbage. So that is one milestone we've gathered from this time. In the 15th century, many Italian towns and cities created plague boards. The purpose of these boards was to keep the people informed of the preventions, treatments, observation stations, and isolation hospitals. The act of informing people and spreading valuable information about disease prevention, health risks, and resources is vital to the health education profession today. We have health agencies such as the CDC and the WHO that focus on providing accurate health information through the use of news, social media, and other communication platforms.
Hello class, my name is Oren Griffith and I'll be covering the Renaissance period. The Renaissance is characterized by the search of knowledge and overall shift in the way people viewed the world and humankind. Where superstitions and ignorance dominated the time period before, the Renaissance brought exploration, increased trade-in, and a renewed interest in scientific inquiry, including cause and effect. During the Renaissance period, disease and plague was still an ongoing hurdle and common treatment was limited to basic medical practices such as bloodletting and examining the urine for changes in color, which when done by a true physician was known as water casting. This was considered the principal diagnostic test for many years within the medical profession. Overall, public health practices still left much to be desired during the Renaissance across all social classes. The biggest issue was human waste disposal. The higher social classes commonly used latrines within large projections on the face of walls that led to pits, moats, and streams near the outskirts of the castle or structure. The lower social classes simply used chamber pots and threw their contents out of a window. There were several health education and promotion milestones during the Renaissance period that were indirectly correlated with the scientific advancements during this time. Anthony van Leeuwenhoek discovered the microscope and advanced it greatly, producing the fields of bacteriology and protozoology, as well as advancing the field of parasitology. These fields lend vital information to health education and promotion in terms of understanding disease processes and providing actionable prevention strategies. Leeuwenhoek also provided exposure to other cell types, including human skin and skeletal muscle, which also added to the continued development in other scientific fields. The field of epidemiology is a huge cornerstone of health education and promotion as its findings directly influence the information public health officials disperse to their respective populations. Different areas of epidemiological research include disease surveillance, disease transmission and causation, biomonitoring, and comparing the effects of different treatment options within clinical trials. The research is critical in many areas of public health, including evaluating the risk of cardiovascular disease among ethnic groups as well as evaluating and slowing down disease outbreaks such as in the current COVID-19 pandemic. John Grunt provided many advancements in the field of epidemiology, possibly even being considered the first epidemiologist during the Renaissance period. His conclusions, drawn from the various forms of public health data from his time, were published weekly in the Bills of Mortality. His findings included observing more males than females were born, higher death rates during the first years of life than in later years in life, and higher death rates among urban dwellers than rural dwellers.